What factors influence healthcare accessibility in rural areas? Have you ever wondered why accessing healthcare in rural areas can be so challenging? Many factors come into play that affect how residents, including those with disabilities, can obtain the medical services they need. Let's break down these factors in a straightforward way. First, the availability of healthcare providers and facilities is a significant issue. Rural areas often have fewer healthcare providers compared to urban settings. This includes a shortage of primary care physicians, specialists, and mental health professionals. As a result, residents may have limited options for local services. Additionally, many rural hospitals have closed in recent years, which means people must travel longer distances for care. New types of facilities, like rural emergency hospitals, have been introduced to help fill some gaps, but they may not offer a full range of services. Next, geographic distance and transportation play a big role. In rural communities, the distance to healthcare facilities can be quite large. Limited public transportation options make it hard for many people, especially those with mobility challenges, to reach these facilities. This can be especially true for specialized care or emergency services, which are often located far away. Financial barriers also impact healthcare access. Higher poverty and unemployment rates in rural areas mean that many residents struggle to afford healthcare services. Some may lack health insurance or have insurance plans that local providers do not accept. This financial strain can also make it difficult to pay for transportation or take time off work to attend appointments. Another important factor is health literacy and communication. Effective communication between patients and providers is essential for quality care. However, many rural residents face challenges such as limited health literacy or language barriers. This can prevent them from seeking care or fully understanding their treatment options. This is particularly important for individuals with disabilities who may need clear explanations about their health conditions. Privacy and stigma can also discourage people from accessing health care. In small rural communities, concerns about confidentiality related to certain health conditions, including mental health or disabilities, can keep individuals from seeking help. Trust in the healthcare system is vital for improving service utilization. Infrastructure and technology are additional factors. Limited access to high-speed internet in rural areas has historically restricted the use of telehealth services. However, recent investments in broadband infrastructure aim to expand telehealth availability, which can help bridge the gap in access to specialty care and services for individuals with disabilities. Finally, policies and support for the healthcare workforce are crucial. State and federal policies that support rural healthcare infrastructure and workforce recruitment can influence accessibility. Programs that recognize new types of rural healthcare facilities and provide financial incentives help sustain services. Legislative efforts to support rural health workforce retention and alternative care delivery models are ongoing. In practical terms, expanding telehealth services can greatly benefit individuals with disabilities in rural areas, allowing them to access specialists without the burden of travel. Training healthcare providers in disability-inclusive practices can improve care quality and patient confidence. Transportation assistance programs and flexible appointment scheduling can also help reduce barriers related to distance and time. Policies that support rural health facilities and workforce are essential to maintain access to necessary services. Healthcare accessibility in rural areas depends on a mix of provider availability, geographic and financial factors, communication, infrastructure, and supportive policies. Addressing these factors with a focus on inclusivity and the specific needs of individuals with disabilities is essential for ensuring equitable access to quality healthcare services in rural communities.